Welcome to Deep Dive Dialogue. Our topic for today is Emerging Landscape of Digital Pathology. Digital pathology is revolutionizing diagnostics through AI-driven image analysis, enabling more precise and efficient diagnosis. Integrating digital tools enhances collaboration, remote consultation, and data sharing. This shift supports personalized medicine, improves workflow efficiency, and fosters innovation in predictive analytics, reshaping the future of pathology. Our speaker for the panel today is Dr. Atul Tiwari. Dr. Atul Tiwari is a visionary in the field of artificial intelligence in healthcare, holding advanced degrees in AI, machine learning, and deep learning. His research is at the forefront of developing AI-driven tools that enhances the diagnosis of complex diseases and analyze vast medical datasets to uncover insights into disease progression and treatment efficacy. Dr. Tiwari's work is dedicated to bridging the gap between the traditional medicine and innovative technology with the goal of revolutionizing healthcare. He's committed to making healthcare more accessible and affordable for all. So, welcome, Dr. Atul.
Thank you. Thank you so much. I think I deserve that much of introduction, but yeah, that's quite a lot. I think you have exaggerated everything.
First of all, I would like to ask you that what is digital pathology and how does it differ from traditional pathology?
So basically, digital pathology, it is a practice of analyzing, interpreting, managing the pathology slides in a digital format. Traditionally, what do? We visualize the glass slide under the microscope. But in case of digital pathology, we scan the slide under a whole slide scanner and we take a large size of image. Typically, this size varies from 1 GB to 15 GB depending on what much of resolution we can afford. I'm saying the word afford, not that how much can we do, because right now it is very costly. So if we can scan at a very high resolution, it is very beneficial, not just in terms of diagnostic, but in terms of future AI validation, because we are going towards artificial intelligence, whether we accept it with a grace, like humbly or not so friendly, but things will change. It is same thing as type. Some days our earlier generations used to use typewriter. Right now we are using computers. So it's not that the typewriters there was a fight between typewriter and a computer. So it is the same thing here also. But in case of digital pathology, then it would give us an advantage that if the slide is scanned, then it will have an advantage over the traditional, the glass slide viewing technology that we are doing currently, over the visualization part, data management part, and remote collaboration, as well as automation. What do I mean by visualization? Like in traditional pathology, we can hardly view the glass slide either one person, or if the byhead is there, then two-person can visualize at the same time. Or if we go into the medical college, then they can use decahead, where 10 students can learn from one slide. As you are also a pathologist, yeah. So I know that if when I was a student, my senior used to teach me that okay, check at the 3 o'clock position, there is a cell lying down that is cancerous or that is malignant. But if at 3 o'clock there are so many cells, right, you know, in histopathology, so which cell are we talking about? So it is difficult to educate. Anyways, we educated our earlier generation educated, so it is not like that impossible. But with this digital pathology, we can easily pinpoint something. And if I have a new question, okay, you taught me about this cell, but there are thousands of cells. Earlier we hesitated to ask, like, okay, what is the surrounding cell? What is the surrounding cell that to next to that cell? Now we can easily ask that, we can easily learn that, we can easily interpret it. So visualization part is that. Then data management. If we go with the small setup lab, like most of the pathologists don't have a lab that is so vast like the branded labs are there. So in that case, if I ask, the same case came 2 or 3 days ago with same different type of peripheral blood finding. Now PBF is not that slide that we used to preserve. If some leukemia is there, then we might even think as a small pathology lab, okay, we should preserve this slide. But if some anemia is there, who wants to preserve that slide, because it would take efforts to file a proper filing and all those sort of things. But if digital pathology is there, we just need a case number or some unique number through which we can identify all the slides that has come with that patient ID. Similar to digital X-ray or CT scan, we can easily access the previous reports. So here it will help in the data management. The third thing is remote collaboration. With the glass slide, what happens is, if I have a doubt in my case which I am viewing, if I want to review it from you, I need to courier it. There are high chances that I won't do it, either it will break, or there are many ifs and buts in this transportation system. But in digital pathology, if it is there, I just don't need any like expensive software. I can just use Team Viewer, any free of cost remote screen viewer, any software. I can share my screen, I can ask my doubt to any expert, and I can have instant second opinion. And in pathology, like over the years, what I have realized, not like clinicians, they discuss the cases as much as we do. Like every now and then there is a new WHO classification. We need to be updated for that. And every day body system has a newer classification, newer staging, everything is updated. So we can't know everything every time. Something is updating right now also. So we always discuss our typical cases with our colleagues. So in case of digital pathology, remote collaboration becomes easier. Lastly, the automation part comes. In case of automation also, there are advanced algorithms which we will discuss in a bit because it is related to artificial intelligence. So they help in management as well as diagnosis, as well as it is helpful for patient, because ultimate what is our ultimate aim? Our ultimate aim should be that it should be beneficial to the patient. So patient would be benefited if we get accurate diagnosis as early as possible. So in that manner, it is very helpful.
Yeah. You have summarized very nicely. I think you have covered each and every part of pathology here. So could you tell me the role of artificial intelligence and machine learning in digital pathology?
Yeah, actually that is one of my area of expertise right now, and it is a question that I would like to answer with because most of the people right now they are still confused whether we should accept AI or whether we should refrain from AI, and we should protest that AI shouldn't be there in pathology or in healthcare or anywhere in the world, because it is, most of the people are afraid that if AI can, as a pathologist, if AI can diagnose a slide, what is the role of the pathologist? Most of the people, most of my colleagues are afraid of this kind of thing. When I show them that I have made this thing, it can diagnose leukemia, it can diagnose some GI pathology, then they will say, okay, who will ask us? I ask them the same question, that our forefathers, when they used to do that counter, CBC counter, like thak 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 and all that. Manual counting used to be done at that time. So and after that came like 3 parts, 5 parts, 7 parts. Now so many parts CBC machine has come. Did that outcasted us? No. We only improved the accuracy of the diagnosis. So in that way, AI and machine learning, both of these things, they are subset of one another. So these things will ultimately help us getting better diagnosis. So in AI, with respect to pathology, if I talk about AI, in pathology, 70 to 80% task is related to glass slides in a decent lab. I'm not talking about the molecular pathologists. They are doing at whole next level of work. Their glass slides are not there, but other things are there. AI is applicable for that also. But I think for today, we will discuss about the routine pathologist work that we do in most of the lab. So we work on glass slides. So in glass slide, what is there? If I see through microscope, I see an image. So that is called as a branch of artificial intelligence and machine learning, that is called as deep learning, where we deal with image analysis. It is a kind of, if I can put in an easy way, who don't know what is deep learning, it is the same thing. We all of us have used Facebook and any other social media platform. So how do they recognize our faces? How do they ask us to tag our friends? So it is the same technology. These MNCs, they are using algorithm, the same deep learning algorithm, to recognize the human face, to recognize our friends and all the circle, and they ask us to tag, and that's how they're learning. So in the same case, in case of pathology, radiology, ophthalmology, dermatology, all of the branches where images are being dealt, the same technology, we are training the machine first, that okay, this is a leukemic cell, this is a neutrophil, this is the stromal part, this is a fibrous septa. That's how we train it. Later on, machine realizes, machine won't interpret it in the exactly same way that we do. Machine will ultimately convert everything into 0 and 1. I think everybody should know that computer, even if we type from A to Z, it doesn't matter. For computer, it is always 0 and 1. So in the end, it will convert it in something 0 and 1, which we don't need to know, like what, how it will convert a fibrous septa into 0, but it is converting. Engineers are doing that work. We don't need to bother about it. So that's how an image is trained, and ultimately the analysis part will come. So suppose if I train a leukemia dataset, there are so many datasets are available. If I train a leukemia dataset, that will help me early diagnosing. For example, if subleukemic leukemia is there are low blast count. As a pathologist, what we see in general practice, we try to safeguard ourselves also, because it is an what I have seen. If two pathologists are there, they might debate, and both of them are right. Like they are doubtful whether this can be a blast or that this can be an atypical cell. There are hundreds of cases might be there. So it is not like everybody is sure. We need an special stain to confirm. So for leukemia, we need MPO, a pass. If they are not there, sometimes we will report even a mildly leukemic case to atypical cells are seen. Further studies required correlate clinically, those kind of things. But if there is a tool, a supportive tool such as AI mediated kind of thing, so that will aid. So if I am in the right direction, and if my AI model is accurate enough, I am quoting accurate enough, not just any randomly picked AI model. If it has been validated and it is saying that this might be a blast, then again it is a proof that I am going in right direction. I should not underreport it. I should not get confused like okay, we will wait for another few days. Then this is what we do. This is a real practice. I'm not making it up. Everybody who is every patient who is just a borderline case, we try to wait for a few days or for another sample.
Yeah.
So if AI model is there, then that another sample wait time that will reduce. So ultimately it will be a benefit to the patient, as well as it will be a helpful aid for the doctor or the pathologist.
Correct.
Then there are some predictive analytics parts are there in AI, like for every organ system. For brain tumor, there is already a good machine learning model, deep learning model is there. For prostate adenocarcinoma, there is a very good, like that adenocarcinoma model is already FDA approved. I think it's on PACE Foundation website, it is there. Yes. Breast carcinoma is there.
Yes.
And one peculiar aspect of this artificial intelligence, for which right now I have not that much of expertise, but I have read work. I just did a small proof of concept kind of thing, but that is fascinated to me, and I really want to work on that someday. In artificial intelligence, in deep learning, there is a subset called as GAN, that is Generative Adversarial Network. Now, through your platform, I want to let audience know that what does this GAN mean, just for a minute. It would be a little bit tough, but it is an interesting thing. With respect to pathology, I have not seen its use in any other healthcare system, but for pathology, it is very good. In pathology, what we can do from this, suppose breast cancer is there, H&E slide is there. What do we do for if IDC is there, suspected? We need ER, PR, HER2/neu. But I have a small setup. I don't have IST. I need to refer the case to higher center. Suppose a patient comes from village area to a district hospital. Now, if I ask him to go metro city, he will be getting lost, literally lost. What this GAN can do, at least in research, it has shown a ER, PR, HER2/neu images just from the H&E image of breast carcinoma. One can just imagine how can AI be so good that it can, without needing any ISC, it can generate ISC images. This is called virtual ISC. So very much fascinated about this kind of thing. So
Right.
this is another very good domain. Then there are so many domains for which I have a huge course also. So it's not possible for me to summarize it in a 5 or 10 minutes.
But I think it's very beneficial, whatever you have said. So, how accurate and reliable are digital pathology interpretation for precise diagnosis?
So digital pathology, it has proven high accuracy and reliability for precision diagnosis. But there are certain conditions that are applied over it. So the conditions are that the image of high resolution. Glass slide can be scanned with a very low resolution. The size would be around 1 GB or even 500 MB, and it can be scanned over 100x images, oil immersion, and with a very good quality of lens. Then the size would be of 15 GB, somewhere around 15 GB. They can be even more size depending on the resolution. But if the resolution is good, so that can even pick the minute thing. Just for example, right now I'm thinking H. pylori is there. Sometimes it gets stuck in between some mucus part, and a new PG or new trainee, they miss out the glass slide. And if even if I want to confirm on some of the cases, then I need a special stain. But if a model is already trained on that thing, it will pick up very minute thing that is on also on the 40x also. So it will help us. Then consistency. There might be dispute between the two pathologists. The inter-observer variation is very common in whenever we see on image, on especially on the glass slide. Then inter-observer variation is part and parcel of our life. So if we have an AI model or on the digital pathology, then it will help us getting a diagnosis accurate enough, and it will help us maintaining the consistency. Using the AI integration, there AI can easily pick up. If the model is trained very good, then it will pick up the very subtle patterns also. So by subtle, I mean those who are working in a very good lab or very high molecular kind of setup, those kind of lab, they are up to date with the WHO classification or the newer changes that are being there. So just for example, if I want to quote it like this, there is an AML entity, that is AML, where this cup-shaped blast are seen. So it is not a common kind of thing, cup-shaped blast. Which kind of mutation would be there? So NPM1 mutation is there. So people who are working in a medical college or in a molecular lab, they are used to hearing this. But if we ask for a pathologist who just opened his lab in a not so big city, they are not used to seeing this, and there are high chances that this NPM1 blast will be missed out, and they will suggest just for go with the PML RARA. So those kind of things in the AI integration will help us. And similarly for the validation studies, it is very helpful in precision diagnosis.
Right. So, how does digital pathology improve the workflow in laboratory?
So in laboratory workflow, digital pathology, it helps us very in a very good way that it streamlines slides management. Like I mentioned earlier, slide filing is a tedious task. Small labs, they can't handle so much of slide management. They only can store, most of them store only the cases where there is either there's some kind of neoplasia is there, or if they require some slide to be preserved. Otherwise, on most of the slides, on the most of the reports, we see that sample would be discarded after this many days, slides will be discarded after this many days. So if we have a digital pathology system, we can store slides for a longer period of time. Nowadays, cloud storing has become quite affordable as compared to 5 years ago. So many competitors are there, and that has lowered down the prices. So it is easy to manage the slides on the cloud. Then there can be enhanced collaboration. Suppose if I'm working in a small lab, I don't have any other fellow pathologist. If I'm stuck on some case, I want a second opinion. I need to send the glass slide to someone else. But if I have a digital slide, then I can anytime ask one of my friend, okay, whenever you get the free, you can just have a quick second opinion if I am on the right track or not. So remote work capability is there. Sample has come in the lab, And suppose if there is a government holiday or whatever reason that curfew is there, so if we are not going there, COVID has taught us this thing very well, that sometimes we can't go to our lab just to do reporting. So if digital pathology is there, then we can report and from anywhere. We can report from our iPad also at our home at our convenience. So remote work capability is there. Then automated analysis is there. If we use AI algorithm, then it will help us segregating from like urgent case to non-urgent, also from severe to less severe or easy case, whatever we call it. It will help us segregating it. Generally, if I work in a busy lab, I go with the serial number, like whichever came early, whichever sample came early. Medical emergency cases are also there. Sometimes they are missed out. For example, AML with PML RARA, it is considered as medical emergency, but I don't know until I see the slide. But if the digital pathology is there, AI algorithm is there, if it is suspecting that all rods are there, so it will just flag it. At least it will help me to pick that case early, not just diagnosis. It has already given me an aid. It is helping me reducing the time to give early diagnosis in both ways, by giving me a diagnosis, tentative diagnosis, and by flagging the case so that I can report it early also. So it will help in both ways. Then there is integration with the other system, like LIS is also there. Most of the biochemistry thing, they are well equipped with LIS, because they are generated, the reports are generated from machine and easily transmitted to computer system. But for glass slide, first we do is we view the glass slide under the microscope. Generally, we don't just sit next to a computer and a microscope, and it's not like that. We are typing and we are seeing the slide under the microscope. In that case, what the traditional practice is, we write on a paper with a pen, and then we give it to computer operator. Okay, digitalize this. But if AI integration is there, half of the report is generated. We just need to, like text to speech or speech to text tools are there. We just need to speak out some key points that are specific to that particular case, and the report can be easily generated. And it would be a very good thing if lab can incorporate those kind of things.
Correct. And what training and education are required for pathologists to effectively use digital pathology tools?
So if someone is already a pathologist, more than half of the things he has already done during his PG or during his practice. Only thing is, he just need to get acquainted with the newer technology. I might say like this. When I entered in a medical college just for my post graduation, I was new to microscope handling. In my UG days, I saw a monocular microscope. I didn't need any eye training that my binocular vision should be there. Under UG, generally, it's a trend that people are not used to binocular vision and all those sort of things. So sometimes for some people, binocular vision comes within 24 hours. In the same day. For me, it took 2 to 3 months. Even my faculty used to laugh. Okay, go to the ophthalmologist and go check your eyes. How you cannot see with the both of the eyes. So it took time, and it varied from a single day to 3 months to sometimes even I see people who have done their MD in pathology and still they just close their one eye and see with one, or just shut the one piece of this binocular microscope. They are happy with one eye. So it is kind of training. So same kind of training we need to view the glass slide in a digitalized format in our iPad. Because in iPad, if I tap on 4x, then it will show me the image under 4x. But what would be my reflex? I will just pinch my finger and I will zoom it digitally. So if I accidentally zoom it, then 4x will switch to 10x. So this is a very little bit of training as compared to what we did in our PG time. So one thing is this machine handling. Another is AI ML integration. For AI ML integration, one should know a basic computer. So it's like during our PG, we need to present the seminar, we need to make the PPT. Some of us are good at least handling PPT, making presenting in journal club. Some of us they are not very good in computers. Not just, I won't say very good, they are not at all good in computer. They don't know what is PowerPoint, they don't know how to make a presentation. So they are dependent on fellow. For those it would be difficult, like if they don't even know Word, Excel, PowerPoint, then how will they know, how will they use AI ML product into the technology? So we need to understand that much of computers. So that is there. Then little bit of technical proficiency should be there to manage the digital slides, how to retrieve a slide. So there will be one software that is handling the slide management thing. So if I need to procure a slide from January, so in software, where should I enter that number? Those kind of things, although those are basic, but I know there are so many people for those it would be even difficult. I have seen those people also, and I don't disrespect them. It's like I don't know everything. They can't know everything. One cannot know everything. They will be good at something and bad at something. Then quality assurance. We need to teach them how digital slides need quality assurance and quality control. In case of glass slide, there is a certain protocol for digital this quality control. Like if staining is worse, if hematoxylin is more, if eosin is more, so we need to adjust the levels. So in similar way, in case of digital images, if those are scanned properly, if slide was not scanned properly, then images won't be good enough. So one should understand what would be the effect of increasing contrast or decreasing brightness for the image. That might even change the diagnosis. Like if, just for example, if H. pylori case is there, GI endoscopic biopsy is there, if I just decrease the brightness and decrease this contrast, so H. pylori, already they are so tiny, they will get lost in this increase and decrease kind of game thing. So one should understand that much of technical details. Lastly, the continuing education, it is helpful. Like someone, if a good case came in AIMS Delhi, if they are presenting a seminar and if they can present digitally all over the world, any student can learn from them. We don't have that much of technical, that much of rare cases in our center. We can teach our students also. It would be beneficial in that case.
Correct. Correct. So you have, I think, summarized all the points which revolve around digital pathology, and I truly believe that it's a game changer, and it gives us precise diagnosis and improves the accuracy. And with training and education, it is the way forward. Thank you so much, Dr. Atul. Thank you so much.
Thank you so much, ma'am.